soon.
Hey guys, how's it going? So, as promised, I am coming back in with some little stories of my experience in the hospital this past few days. My program requires me to do hours in the emergency room on weekends, so the hours haven't been too strenuous just yet because it is an intro. It was very interesting seeing how few emergencies there actually were, because what you'll find in a lot of emergency rooms, particularly in this region, is that people come in presenting with headaches, stomach aches, just ailments that you might think are not too serious, like when you're watching Grey's Anatomy and you see people rushing in with their arms hanging off of their shoulders, or what have you. So it's not like that at all. Sometimes it comes down to people not having insurance and just needing to be seen by somebody, so they just come into the emergency room. I actually was able to help set up some IV line, get blood samples for the attending physicians from the patients who had been admitted to the hospital. Also, just got to interview patients here and there, finding out what brought them to the hospital, what brought them to the ER. Then Monday was kind of crazy because they had called a code blue. So I have a little segment from that day that I'll put in. But okay, today, what happened yesterday? Today's Wednesday. Yesterday, I was in med-surg. So med-surg, there wasn't really too much going on. Wait, no. Med-surg was Monday. My bad. Med-surg was Monday. Yesterday was when they called the code blue. So med-surg on Monday, there wasn't really too much. Basically what they're doing is administering medications to patients. Some of the patients have been there for up to 2 years. Yes, 2 years. There was one patient who had been there for 2 years because he has nowhere else to go. He's homeless. He is on dialysis, so he needs to remain at the hospital to maintain that treatment. Then I was in ICU yesterday. ICU is where they call the code blue. There is a woman who had come in for a TEE procedure, and she started getting VTAC. So they gave her adenosine and her heart rate skyrocketed. So they needed to call in the attending physician. They basically initiated the code sequence and got the attending from the ER, gave her etomidate and succinylcholine so that they could intubate and maintain her airway. And we just saw everything happening in live action. It was really cool because the things that you learn in ACLS about maintaining closed loop communication and making sure there's a scribe and everyone's up to date with what's going on, and sometimes that gets thrown out the window because as things are happening, tensions are high, and it shouldn't get that way. You have to maintain composure and you have to keep the environment stress-free so that people can get the right medication dosages, and also make sure that you're not giving more than you need. For example, if you're not taking down notes on, okay, we already gave her this drug, and you give her more, then you could have even more problems to deal with. So it's really important to have a scribe during those code sequences. But we were just kind of watching on the outside looking in, and it was very admirable to see the attending physician who I actually got to work with last week in the hospitalist rotation. I saw him just keeping everything cool, just calming everyone down. He wasn't freaking out. Even when things were turning left, he was like, okay, let's just recalibrate and figure out what we need to do. So that was very admirable to see. Today, I actually got to help deliver a baby, my first baby. And oh my gosh, I love babies. Like, everyone who knows me knows that. I have some friends who send me pictures of babies all the time because they're like, oh, I know you like this, like, you got baby fever or whatever. But even when I was a kid, like I loved kids who were, younger than me. And that's basically one of the reasons why I was looking into peds. But who knows? It may change because after today, I'm thinking, OB is a really cool field too. You also get to interact with um, infants. So it's not, um, it's more than just working with the kids, though you also need to work with the mothers, and many times you're working with them throughout the pregnancy. But enough about that. I'll tell you how the experience was. So we got to basically what happens was um, we have about, I would say, 20 students, 18 or 20 students, and we each get sectioned off in pairs. And this week is nursing week, so we're going to different floors and different departments, working with the nurses, seeing what they actually do, because the nurses are basically the right hand of the physicians, right? They're the ones who are monitoring the patients around the clock. They are the ones who are updating the physicians and letting them know, hey, I don't think this antibiotic is, as effective as we had hoped, or this is what their stats are right now. So we as physicians will rely heavily, heavily on the nurses. So you have to be keeping a good relationship with your nurses. So me and my partner got to the floor and it seemed pretty quiet. It was around 11 o'clock. I guess things were quiet for the day. And we were told that there was a woman who was ready to give birth that day. She actually was 40 weeks along, so she was getting an induced labor. And I was like, wait a second, this is actually probably going to happen, because they weren't really sure. But they checked how far she was dilated, and she was 10 centimeters. She started off at 3 centimeters when she came in at 7 a.m. this morning, and now she could feel the head. So she was on an IV drip of lactated ringers to keep her hydrated, and also she had been given an epidural that morning for pain relief. So she was chilling. Like, this is the most chill mother I've ever seen in my life. I have never seen someone give birth before today, but obviously on TV you have those exaggerated births where she's like, oh my god, like screaming and like holding on to everyone around her, and they're like, what is it? All the lights are bright and the doctors are just yelling across the room at each other. But no, it was just 2 nurses and 3 of her family members and her, and then 2 of us students. So the family was predominantly Spanish speaking. Every room that you go into in this hospital will let you know the patient's name, why they're there, any precautions, like if they're allergic to anything or if they're on fall precaution, anything like that, and their primary language. So her primary language is Spanish. Luckily, I do speak Spanish, but after being here, I feel like I have more to learn because there's a different dialect, because it's mostly Cuban population here, but I'm learning so much every day. We introduced ourselves as the medical students, and the nurse asked if it was okay if we stayed, and the mother was totally cool with it. She is a nurse herself, so I think she was more willing to help us with this educational experience. After today, if I had any reservations of letting any students be in the room if I were giving birth, I would totally let them in because I got that opportunity. It's one thing because it's such a private experience and you're just open, like, for lack of better terminology, and you've just got these complete strangers looking at you and just seeing the most intimate parts of you, and you make that sacrifice for education. This is a teaching hospital, and I was so grateful that she allowed us to be in there. So, we're checking the stats. The baby's heart rate was a little bit on the lower side. Usually they want the heart rate between 110 and 160 beats per minute. And if it's lower than 110, they're looking at bradycardia for the infant. If it's higher than 160, they're looking at tachycardia. So for this particular hospital. So the baby's heart rate started off a little bit on the lower side, but started picking back up later on. Not really sure why, and the heart sounds were a little bit muffled. They had this technology where they could actually listen to the baby's heart rate and see the rate as well. Heartbeat. Listen to the heartbeat and see the heart rate. So it was so cool because the nurse turned the woman to her side. She was 33, by the way, 33 years old and 5'11". I couldn't even tell how tall she was until they said it because she was laying down, but I didn't really know how tall she was, and that was really cool to see too. But she was on her side, and apparently the nurse said that that would help the baby descend more quickly down the birth canal without the mother having to push so hard. And I've never heard that before. That was really cool. It seems more of like a midwife technique. So that was really cool to see. This nurse trained in Cuba too. So, actually, sorry, this nurse was from Nicaragua. So maybe that's something that she learned there, or maybe that's something that's universal. I just never heard that before. So she was on her side. It just kept cleaning her up, making sure she was comfortable. We were trying to talk to her as well, and honestly, she was so chill that I felt less anxious for her. You know, I didn't think it would be that relaxing. And then they checked her diameter again. She was at 10 centimeters. So they're like, okay, it's time. So they were like, yeah, let's call the doctor. The doctor took his sweet, precious time to get there. He was in another building of the hospital, and he said, just let me know when she's crowning and I'll be over there. Which I was like, what? Like, usually the doctor is like there the whole time ordering people around, but like I said, this was a very chill environment. So the mother is laying on her side, and then the nurse says, you know what, okay, let's just get her in the right position for birth. So we put up the stirrups so that she could be in the proper position, and they had a waist bag that would be for collection of the afterbirth, and it was time to go. So me and my partner put on our surgical gowns, our gloves and hairnets, and then she started to feel more pressure and pain, which meant the baby was starting to crown. So we were trying to calm her down. She started, sweating, feeling hot. So my colleague went and got some ice cubes for her to, chew on, those little hospital ice chips, because she was hot. And that really helped her a lot. And then they gave her some oxygen and encouraged her to start breathing, taking like deeper breaths. So I also have to give props to the father. The father was chill as well. And now I must say they do have a child from before, but that was 12 years ago. So I don't know how I would feel like if I'm having a kid 12 years later. I think I would still be nervous. Who knows? But anyway, so then what happened? Okay, so the doctor's still not there, and she's like pushing, and I'm like, crap, what if this baby comes out and the doctor's not here? So the doctor finally comes in, he puts on his gloves, he and the nurse make some jokes, because she's like, oh, I've known him for 50 years and he gave birth to me, or sorry, not he gave birth to me, he delivered me. I don't know if that's true, but they've known each other for a long time. So the baby was starting to crown, and they're like, it's coming. I was like trying, and the nurse put my hands on the woman's feet, because she knew that reflexively she was going to kick up, and sure enough she did. So I was there to hold her foot and the baby's just coming out, and I was like, hold up, because this is a vaginal birth, right? And that hole, that hole, this is the baby's normal head, and this is the hole. And it is like morphing through, because you know the fontanelles, um, the skull bones of the baby are still pliable at that time. They're still soft and they haven't fully calcified yet. So it can go through like that. And it was literally coming through like this. I was like, yo. So it came through. And then finally, I don't know. I think I was like in shock and just like overwhelmed by everything, but also so excited. And I just, all of a sudden, I just see the head fully out and the body's coming out, and then I see the umbilical cord, and then the baby's like, here he is, and he pats him on the back and like, wah, wah, starts crying. So I'm like, wow. I look at my colleague like, I didn't feel sick. Like, yeah, there was blood and afterbirth and all that, but I didn't feel sick. I just felt like, oh my gosh, like 1 minute he was in her stomach, the next minute he's out here. He's crying. The doctor cuts the umbilical cord, and it was kind of tough to cut through. Like, I didn't try cutting through it; we weren't allowed to. But, like, it seemed like they were having some difficulty cutting through. And there's 2 arteries and a vein, and we got to see that. So then the nurse transfers the baby to the incubating bed, and she's like, stimulate him, clean him up, stimulate him. So this baby literally has all the blood and maternal juices all on him, and me and my partner are like, oh my god, like we're treating this baby like china glass, like we don't want to break him. She's like, no, do it harder, clean him up, clean his ears, clean his nose. And I'm like, oh my gosh, I just don't want to hurt him, he's so beautiful. Like, cleaning him up. She's like, stimulate him. So they cut off the umbilical cord. They did a footprint for him. So they put, it wasn't really ink. I really don't know how they do it, but like it was just these like white pads. They put it on the feet and they did the footprints for him. And then they did the birth certificate. The doctor signed off. And it's crazy because they never show you this dynamic in the movies or on TV, but the mother is kind of just neglected at once the baby's born for like at least those first few minutes. Like, the mother is on the other side of the room, just laying there and being cleaned up probably by another nurse or the physician's assistant. And then the baby is the one getting all the attention. The relatives who are allowed to be in there, like today there was only 2 relatives who were allowed at that time of birth. They were trying to take pictures. They were like holding their, calling the relatives on the phone and like letting the relatives hear the baby cry. And the mom, I was kind of like looking past the curtain on the other side of the room and looking at the mom, and she's looking over like trying to see her baby. I'm like, oh my god, like I'm getting a better glimpse of her baby before her. Like, this was crazy. So they're just trying to like clean the baby up, suction out any excess fluid from the nose and mouth, and swaddle him so that they can give him back to the mom and make sure that it's, belongs to her rightfully by giving him the tags. He gets 2 tags, the mom gets a tag, and the dad gets a tag. And they don't want to let too many relatives in at once because of safety reasons. Like you hear about all these hospital kidnappings of babies and stuff, so I think that's what they're looking out for. So the baby was born, and obviously we're not allowed to like take pictures with the families or like anything like that, patient confidentiality. But I had the perfect opportunity to like, because I was holding the baby like Simba. The nurse told me like, take the baby, give her to the mom. I was like, oh, me? So like, I scooped the baby up and she's like, hold it. Ooh, somebody take her picture. I'm like, oh no, I'm sorry. I'm not allowed to do that. Can't take any pictures with the baby. But I did take some pictures in my surgical, scrubs later on in another room, not with the patient. Just because you don't take any pictures, it didn't happen, right? So I was like, man, well, I will always remember this baby's name. And, I'll always remember this experience. I don't need a picture with the baby, but and I'll remember the mom and the dad. But it had me thinking about OB, you know, like I know their schedules are very hectic, especially when you have like dozens of deliveries every single day and you can be called in at any time. So, you know, I'm still keeping my options open. I know I love working with kids. And I also in the past have worked with geriatric patients. So I'm keeping my options open. But I really fell in love. Like, this was the first rotation that we did where I was like super excited. Granted, it's a you know, birth, a delivery, but who knows? Like, I'll wait and see how I feel about the rest of them. But this was just so exciting today. So yeah, that was that, and I was super excited. I was like grinning all the way home, listening to my gospel music. I was like, thank you, God, for the gift of life, you know? Like, just think about a woman. First of all, the ability to conceive. You know, she has 9 months. She's sacrificing so much so this little human being can grow and develop in the most healthy way possible in her belly for 9 months. And then he came out. And I can only imagine the joy that she felt seeing the baby finally, even though, yes, she was in a lot of pain right before he was born. But when he was born, it was like all the pain went away. That's what I've been hearing. That's how it is. So it was so amazing. But yeah, so this week has been great. Tomorrow, I'm not sure. We get a different rotation with the nurses every day, so I'm not sure what I'll have, but we're trying to go to surgery tomorrow. So, you know, I also like surgery too. I think what it is I like being hands-on. So surgery, OB, we'll see. But I just like being hands-on, interacting with the patients. So today just gave me confirmation, like, yes, I'm in the right field, because I loved it. And if you love what you're doing, it's never gonna feel like work a day in your life. I think there's a quote about that. So I will keep you guys posted about what happens the rest of this week. And our first big rotation is Family Med, so looking forward to that. So until next time, deuces.
New York, Africa to the world.